Hey guys, welcome back to Authentically Alexis. Today we're going to be talking about ADHD and autism, the similarities, differences, and overlaps between the two. So unfortunately, there's actually very little in professional literature about what it looks like when a person has both ADHD and autism. This is problematic because this can lead to someone being wrongfully diagnosed as one or the other, or being diagnosed with one and not the other, because there are some similarities and overlap, especially in cases of high masking individuals. They may be presenting signs of ADHD and the autism might not be very detectable. So here I'm going to give a very brief explanation of some of the traits on ADHD and autism that we deal with in our daily lives. I'm not going to do a deep dive, so there's going to be definitely some things that I leave out of this video because I'm going to do individual videos specifically on what autism is and specifically on what ADHD is. So ADHD is attention deficit hyperactivity disorder. Now there is some pushback in the ADHD community about this name because it doesn't exactly fit everyone. So it mainly has to do with attention. A lot of times it's attention deficits, but it can also mean like extreme attention and hyper focusing on the things that you're interested in. So there are two main forms of ADHD. There's hyperactive type and inattentive type. Hyperactive type is kind of the stereotypical what you think about when you think of ADHD. You normally would think about a child that's extremely hyperactive, moving their body a lot, talks really quickly. That's what the majority of the population sees in their mind when they think about ADHD. The flip side is inattentive type. That is the type that I have at this point in my life. So inattentive type ADHD presents more as people that are kind of daydreamers, like they space out a lot, they tend to be in their own minds, and they're not as hyperactive. As a child, I definitely displayed hyperactive traits, and as I've become an adult, I've kind of more went into the inattentive side. Now, we don't exactly have this down to a science. There's a lot of different theories out there. For example, Dr. Daniel Amen believes that there's like 6 or 7 different types of ADHD, and he actually wrote a whole book on it. So ADHD has more to do with attention and regulation or lack thereof. And autism, attention is only a small part of it. Autism is just more all over the place. In ADHD, we crave stimuli. This can come across as being reckless or really enjoying spontaneity, and this is due to a lack of the neurotransmitter dopamine in our brains. This is why stimulants sometimes work for individuals with ADHD, because if we have a lack of stimulants in our brain, we're going to be seeking that in the external world, right? So say we're trying to sit down and do homework and there's just not enough stimulation going on. If you give someone with ADHD a stimulant, it can help the brain produce more of it so that we're not seeking it in external forms and we can better focus. We could also tend to make impulsive decisions. We can tend to be quite messy and disorganized, and also struggle with object permanence. That's kind of like if something's not in plain sight, we forget that it's there altogether. Now with autism, it can be quite the opposite. We crave routine and structure. We do well with a really well thought out plan. We like to know what to expect before it happens, and we may have a difficulty in understanding social rules. We tend to notice really small details and patterns, and we like things to be orderly and organized. Actions can be meticulously planned out, but we can struggle with autistic inertia, which means the difficulty with starting and stopping tasks. I spoke about this in my last video. It's like we have a hard time getting the ball rolling, but then once the ball is rolling, we have a hard time stopping it. We also can have a hard time regulating and understanding our emotions. We might feel something really strongly but not really know how to put it into words, and it can take us a lot more time to process our emotions. So those are some of the sets of struggles in our day-to-day lives when it comes to ADHD and autism. Now to talk about the overlap. Now ADHD and autism are both neurodevelopmental conditions. It's a common misconception that ADHD is a learning disorder, which it's not. ADHD and autism are neither learning disorders nor are they intellectual disorders. An intellectual disorder is what used to be known as mental retardation, which is not a term anymore. So what this means, being a neurological disorder is that it has to do with the way that our brain is wired during its developmental stages. So there are both similarities and stark differences between the two. And if you have both of them, that can mean that your mind's in constant battle with itself. You may really crave routine and structure and organization and knowing what comes next, but not be able to do that because of your ADHD. So you might actually be really disorganized, be really forgetful. That can cause a lot of confusion and frustration. It's like you're having this internal dialogue where one part of you is starkly different than the other part, and they're battling, and you're being pulled in both directions. They both also have similar unhelpful stereotypes. One of them being that they only affect young boys, which is just completely untrue. They both will give the tendency to hyperfocus. In autism, this has to do with our special interests usually. But in both, it's like if you are interested in a subject, you have this intense ability to really zone in on that subject and learn all there is to know about it. But if you're being forced to learn something you're not interested in, that can be a struggle with both autism and ADHD. Both autism and ADHD can cause the individual to stim, which is self-stimulatory behavior. This is another thing that during assessments can be picked up on both sides, and that can lead to a wrongful diagnosis. Anxiety and depression are both things that can affect people with ADHD and autism, as well as sleep disturbances and poor executive functioning skills. Executive functioning is kind of like remembering to do things, setting an appointment and keeping that appointment, poor time management skills, just taking care of things that need to be taken care of on a timely basis. And there's other co-occurring conditions that can show up in both sides, even addiction to alcohol or substances, as well as self-harming behavior. Both have issues with regulating behavior, which can cause issues in our social relationships and really leave us feeling misunderstood. They also both generally have a struggle with demand avoidance, which just means really not wanting to do something that we know that we need to do. And this kind of generally goes beyond like, clean your room. No, I don't want to clean my room. It's more intense than that. And that also plays into the autistic inertia. I believe that the inertia kind of affects people with ADHD too, because it's really daunting to have a task that you know you need to do, and it's kind of this feeling of not knowing how to start and trying to force yourself to start. So as you can imagine, because there are similarities but also really stark differences between ADHD and autism, that can leave us feeling really frustrated and confused as to what our needs are. We can be both understimulated and overstimulated at the same time. And conforming our behaviors to society can be very difficult and even impossible for some. So there we have it. There is a quick rundown on autism and ADHD, similarities, differences, and overlaps. I plan on going into more detail in individual videos. So my autism video will go more into detail about other things that I didn't talk about in this one, and likewise with the ADHD video. And as always, thanks for watching. Please subscribe or give this video a like or leave a comment down below. It can really help my channel grow. Until next time.